Online learning does not have to be scary. And Madison College was there for me.
We have people that are dedicated to our students' online success.
We can help you with your technology.
Give us the college try for 7 days. No risk, no worries. Madison College.
There we are. So I've been talking now for a minute and for like 3 minutes, and you couldn't hear me. Sorry about that. So I'll back up and catch up here. 2,791 new cases today out of 10,500 tests. That is fewer tests, so therefore fewer cases. That's basically what we're looking at today. The positive test rate for the past 7 days is 31.1 in terms of people. 31.1% of people who were tested positive in the past 7 days. That's very, very high. It's about the same as it was yesterday. Yesterday was 31.3. The percentage of total tests that came back positive is 13.5, which is also very high. That takes into account that many people are tested multiple times over the course of the week. So if you get 3 or 4 different tests, each one of those is counted as a new test, but you're not counted as a new person each time. So of all those tests, 13.5 come back positive, 13.5%. That really needs to be below 3 before we can say that we're really headed in the right direction. And that has been going up basically for the past, week and a half or so. It's been hovering right around. It peaked at 16. No, actually, it peaked at over 18 at one point, about a month ago. But now it's been kind of floating downward. It hit about 12. Now it's about 13.5. We did also report 17 deaths today, which is fewer than we've seen. But it's also a Sunday. Last Sunday, we reported 22. So it's a little bit better than last Sunday. Although previous Sundays have been like 6 or 0 a couple Sundays ago, 12. Weekends are just typically lower in terms of reporting deaths. Again, this aren't people. Doesn't mean fewer people died today. It just means fewer deaths were reported into the data. It takes a week or two after somebody passes away to make it into the data, which is what we're finding. So, even with that 17 puts our total death toll over 3,700 now. We're at 3,702. And also puts us at 58, basically 59 deaths per day. Slightly lower than yesterday. 58.9 today. It was 59.5 yesterday. 14-day average of deaths is now 51. I believe that's the first time that's been over 50. 7-day new cases is now 4,157 per day over the past 4 days. 7 days, I'm sorry. And that reflects that we've been basically, since Thanksgiving, our testing has been much lower than during most of November. During most of November, we were reporting, 14, 15, 17,000 tests a day. I think there was a big spike in testing leading into Thanksgiving as people were deciding whether or not to go to Thanksgiving and getting tested to see if they could go, which was, I don't quite understand that, because a negative test doesn't mean you're immune, You can't get a negative test and then say, okay, I'm safe to go to Thanksgiving, because you could literally contract the virus on your way home from being tested. But anyway, a lot of people did that. And now are not getting tested at this point. Many people were told to wait a few days after Thanksgiving, but it's been over a week now. It's been 10 days since Thanksgiving. And, we're not quite seeing a big spike yet. We're also not seeing a big increase in testing. So it's going to be hard to see a spike if we're not getting tested. So we need to see the testing go up. I would anticipate tomorrow, Mondays are typically lower as well. So I would anticipate seeing fewer tests processed tomorrow and a lower number again tomorrow in terms of cases and deaths. One interesting, maybe interesting isn't the right word, but one unfortunate thing is that of the 17 deaths reported today, 7 were in Barron County, which is a very rural county. So to see 7 deaths there is not exactly what you want to see. The other counties that saw deaths today were Vernon County had 3, and then Winnebago, Waukesha, Milwaukee, Manitowoc, La Crosse, Eau Claire, and Dunn County each reported 1. So exactly why Barron County is reporting 7 today is hard to say. It could be. It could be. This is a speculation on my part, but it could be that they've been kind of, Barron County doesn't have a lot of staff, doesn't have a big, robust medical examiner's office. It might have, or a public health department for that matter. It might be just as simple as, people have passed away over the course of the last month, and they've haven't been reporting them to the state yet. And so that could be like a catch-up, where they've just had these 7 deaths over the past month or so and are just now getting to report them all. Or it might be just a whole bunch of people passed in a very short period of time over the past week. Either way, it's not great. Don't like to see that. But as I was saying, the total number of fatalities is now past 3,700. Well, we're easily on our way to 5,000 by the end of the month, by the end of the year. 2 pieces of decent news. One, the number of active cases continues to go down. That sort of is a natural consequence also of less testing. Because basically the state sort of has this arbitrary thing where it's any case that's over 30 days old is no longer considered active, even though some people continue having symptoms after 30 days, but not very many. So if you test positive and they don't hear anything more from you, they just assume you're recovered after 30 days. Also, if you get sick and you get hospitalized and then you get better and you get discharged from the hospital, you're considered recovered, even if it hasn't been 30 days. So this is not a perfect measure, but a pretty good measure. But it also reflects the fact that 30 days ago our testing was much higher. And so there are more cases that fall off that 30-day window than are added to it today. So what we have right now is 59,388 active cases. That's 14.4% of the total number of cases we've ever had, which is now 412,160. So it's good the number's going down, that the number of active cases is going down. It's just take it with that grain of salt that also has to do with lower testing. But the fact that it's a much smaller percentage of the total cases is also very positive. That was around 22% for a long time. Now it's 14.4%. Okay, so that's good. The other piece of good news is hospitalizations. Hospitalizations, total number of people hospitalized has been going down steadily for, 10 days or so. It went back up a little bit, 1 or 2 days, but the trend has been downward for almost 2 weeks, I guess. We're now at 1,502 people in the hospital. But remember, that was up near 2,200 at one point. That's 91 fewer than yesterday. Now, I suspect that that's because people are being discharged. We haven't yet seen a significant enough spike in fatalities to say, like, well, the reason there are few people in the hospital is more people are dying. I don't think that's it. And people are actually recovering, are actually being discharged. And or fewer people are being hospitalized. Like, doctors are deciding to be a bit of a higher bar in terms of who they admit to the hospital. Just that people who are come in with COVID who maybe a month ago would have been hospitalized are now saying, no, you're going to be okay to be cared for at home. Could be a number of all those factors together. But the good news is fewer people hospitalized means the bed counts are much better. ICU capacity, let me do some math for you. They're about 86% full, which is about what they've been. That's statewide, of course. That doesn't mean anything about any specific hospital. There are specific hospitals and specific communities that are really at the edge of being overrun, really full, and having to push people into that alternate care facility or out the door, or keep people in the emergency room for 18 to 24 hours while they wait for a bed to open up, that kind of stuff. You don't like to see any of that. But the alternative care facility is down to 6 patients, which is good. That means there are still at least 1 or 2 hospitals that are having to clear people out before they're ready to really go home. So, we're still kind of at that edge of could be bad very soon, but it's not quite there yet, statewide. Okay, so that's good. We'd like to see that hospitalization number continue to go down. Okay, what else do we have for you today? I think that might be it. If there are any questions, drop them in the comments. Again, it's just a little bit hard to say for sure what's happening really statewide with this sort of lower number of tests. So I'm hoping this next week to get a much better picture. I would say by Tuesday or Wednesday, we'll be able to say yes or no whether there was a big Thanksgiving spike. I'm hoping there wasn't. Hoping that we just kind of continue to see normal numbers. I would also anticipate, as we've seen the past 2 weeks, lower numbers of deaths reported Sunday, Monday, and then a big number on Tuesday. Again, I hope that's not the case, but I would not be surprised to see 100 deaths again reported on Tuesday or Wednesday, which has happened the past 2 Tuesdays. But again, it's just a paperwork issue, right? It's not that more people die on Tuesdays. It's just that's when the paperwork tends to come in after the weekends. So that is all I have for you today. I hope you have a wonderful, enjoy the rest of your Sunday. It's Only 10 Minutes podcast returns tomorrow. have a couple of really fun stories for you there. Some actual, pretty good news that'll be on the website tomorrow morning. Some positive stuff for you, and don't forget that we are still collecting donations for our Newsmatch program. Any donation you give in support of local independent community journalism is doubled by Newsmatch. So chip in whatever you can, if you can. Have a wonderful evening, and until tomorrow, we will stay safe, stay well. We'll see you tomorrow afternoon.
This is 365 Media.